Good morning, good afternoon, good evening, wherever we are in the world. A very warm welcome to Meet Menaca, episode 76. Busting the myth of mental illness with Dr. Kalpana Dein, who is a consultant forensic psychiatrist, speaker, and author. Before I go further about the speaker, let me introduce the talk show. Meet Menaca features experts in their own field and real people sharing real stories. It's a vibrant 90-minute multicultural online talk show to celebrate each and every one. It is a free event. To register, you can click the link, what we usually share on Facebook, on YouTube, LinkedIn, on Instagram, on all the social medias, and in our groups. So if you want to join the tribe and become a social change maker, please join our Facebook group or WhatsApp group. The links will be shared shortly. So today, why are we going to talk about busting the myth of mental illness? We have facts, and quite a lot of them these days, about mental illness. But are we any clearer about mental illness? I think with so much of information, we have also kind of got into the myths of it. So much information that sometimes it's become so hard to take out the facts from fiction. Hence, we have invited the expert today to learn more about the truth and have your questions answered by Dr. Kalpana Dein. Now, about Dr. Kalpana Dein, it's such a pleasure to have her on this platform. Firstly, a very warm welcome to you, Kalpana.
Thank you so much. Thank you for having me. It's a real privilege.
Such a pleasure. Kalpana Dein is a passionate about ending the stigma of mental illness and regularly speaks in forums to bust myths around mental illness and its treatment. As a consultant forensic psychiatrist working for the National Health Service in an English prison, she's an expert. Following her graduation in medicine from Trivandrum Medical College, Kerala, India, Kalpana trained in psychiatry in Hampshire and forensic psychiatry in London. Her special interest in working with people with personality disorders and autism has led her to research publications in not only in mental health and crime, but also the impact of culture and religion on improving psychiatric care. Kalpana is pursuing a PhD at Queen Mary's University of London, and as I mentioned, it's such a privilege to have her here. Firstly, Kalpana, my audience know this is a subject very close to my heart. And I think even when we discussed about the show, I mentioned a few things about my personal experiences with mental illness and the stigma attached to it and how people perceive it. But beyond it, as an expert, why do you think it is important to talk about mental illness?
Yeah, thank you so much, Menaca. And, I was really, I was really inspired by your own story. I think it's really important because mental illnesses are treated differently from other illnesses. There is a huge stigma around it, because of which a lot of people suffer in silence instead of getting help because they're terrified about what that help will look like. They have night images in their mind of being sectioned, being straitjacketed, electrocuted, all from fantastic movies, exaggerated media images. And because of that, a lot of people suffer in silence instead of getting help. And when they have loved ones who are desperate for help, they are very hesitant to get help. And all this is because of something called stigma. And mental illnesses are no different to physical illnesses. You see, physical illnesses cause distress, they cause pain, but we have treatments for them. And it's the same with mental illnesses. We have modern treatments for them. And it's important for people to know if they are suffering or if they have a loved one suffering, they can get help. And it will make a tremendous difference in their life. And they should not go by sensationalized Hollywood or programs which terrify people from getting help. So basically, they're treated very differently. And this different treatment we call stigma.
Thank you, Kalpana. I talked to you as well. I have said this and many times on many forums, including my talk show, including in the healthcare professionals. When it comes to their own families, their close ones, their loved ones, they still are stuck by this stigma, which really astonishes me sometimes. I'm sure we'll dive deep into it a bit later. So why do you think there's so much myth around mental health illness, first of all? Because, as I said, the more we learn about it, the more information out there, it sometimes it looks like it's, more myths are there than the other way around. So how can we demystify it?
I think these are very good questions. I think much of the stigma comes from our own fear of losing control, ultimately, isn't it? Because mental illnesses, unlike physical health illnesses, they can influence the mind. But the reality is physical health problems can also influence your mind through hormones and other ways. And there is a fear of losing control. I think the best way to demystify it is programs such as this, and also for honest perspectives, and also to hear the stories of people who suffered with mental health problems, who've been treated, who are receiving treatment and living normal lives. I think that's the only way to demystify it. Unfortunately, we are not helped by so many TV and Hollywood and even BBC programs. BBC is not too bad, actually, but so many others that literally dramatize, sensationalize what the experience of a mental illness or the treatment looks like. Unlike in physical health problems. If you have a physical health problem, you know that you can go and see your GP. Your GP will try and support you, or he'll refer you to a specialist. And the reality is it's exactly the same with mental health problems. You don't, first of all, get taken straight away to a psychiatric hospital. It only happens when people present very, very late in a crisis that they need to go to a hospital. The reality is if you meet your GP early on, or you call, Samaritans, that's a free talk line, helpline, etc. early, you can get a great deal of help early that will prevent a crisis. And if you are in a crisis, again, we have excellent modern treatments available, which are effective at treating people and also have very few side effects. So in Britain, in fact, people are not straitjacketed. It does not happen. It is, so this whole impression that people have that immediately someone gets ill, they're straitjacketed, they're electrocuted, is completely wrong.
Sure.
And I think knowledge is a powerful tool in ending the stigma, as you said, to demystify it.
Thank you so much, Kalpana. It's so good to hear a professional and expert who is passionate about demystifying this, really, because in the entertainment industry, even in Asia, the Bollywood and Collywood, now it's called, is not so far behind in creating these dramatic expressions of mental illnesses and how they act, which is really far from the truth. We have spoken so much about why there is a stigma. Like many other social issues, there are many moving parts to the problem. On one side, we have professionals, and on the other side, as the healthcare, and then we have patients themselves, and then community around them. So together or individually, how can we collectively change this stigma, and what can we do about it, Kalpana?
Okay, that's a really good question, because you can, do a lot. First of all, we have to stop making fun of the mentally ill and using terms which are just very pejorative, saying somebody is mad, things like that, you see, because that makes people who are suffering feel very ashamed. The second is, when people do talk about it in that way, we should gently correct them. No, mental health problems are exactly the same as physical health problems. It is a health problem, and there are treatments available. If you know someone who is suffering, especially if you're close to them, offer to go with them to the GP. I think with any illness, people feel anxious and worried. If they have someone in their family or a friend who says, listen, we can go together to see the GP, that can be very helpful, and they don't have to be there when they actually tell the GP the problems. They can just wait in the waiting room, because some of these things are very personal. But knowing that you have a friend, and let's say somebody, needs to go into a psychiatric hospital, they can go in voluntarily. Again, it's good to go see them. Of course, during COVID, we had all these problems with visiting. But now things are getting more and more relaxed. You can go visit them so they don't feel alone in it. And if they're in hospital, they have regular, what we call ward rounds, where they get to meet their team. They happen at least once a week, sometimes once in 2 weeks. You can offer to go and attend, because as long as the patient is happy for a family member or a friend to be there, or even a pastor or a priest or an imam, you can go and attend. And I think the patient will feel very, very supported. And they can raise questions. If they have questions about the medication, are there alternatives? Is there a therapy instead of medication? Is there some other medication? See, people are more than happy within healthcare to answer these questions. Yeah, so I think the community can do a lot. And they can support them. And I think a very, very big thing, especially with mental health problems, is if you know someone with a mental health problem who is on medication, please, unless you are their doctor, please don't tell them to stop the medication. Because for me, one of the most difficult things is, seeing someone, let's say, with a serious illness like schizophrenia, you've got them on medication and they're doing extremely well. And the great tragedy is someone from their own family, their own mother, will be telling them to stop these medication. And I am horrified as a psychiatrist. This person was so ill, we managed to get them well. And here is their own mother telling them to come off. You see, and they're trying to help them, but they are actually doing them a big disservice. If your child has diabetes, or your child has hypertension, or someone you love has them, and they're on medication, you wouldn't tell them to stop that medication, because it will have serious implications for them. And it's the same with the medication for mental health problems. If you are not their doctor, don't get involved telling them to stop. If you have questions, why not? If they're happy for it, go and meet their doctor along with them.
I couldn't agree more. I was just sitting and listening to you. I have personal experiences and I've witnessed this quite a lot. People who are, as I mentioned, who are even in medical professions, somehow they feel the need to interfere with other people's diagnosis and what medications they take, or even to question, are they definitely having this mental illness or not, and then advise them. And it's even worse when they're not even a medical profession. They think they know better and they tell people not to take these medications. So I'm really glad you addressed this head on and told what should be shared, really. So thank you so much for that. And on the other hand, I think as people, or as a society, or people around each person, what I heard from you, at least my perception is, you're telling not to marginalize them, to be inclusive of them, to go and visit them and support them as much as you can, so they feel part of the society rather than they are marginalized. And because of those worries only, I think parents, families, friends, and even the patients themselves don't want to talk about this, or even sometimes they stop seeking help when they should. So thank you so much, Kalpana. I think it's really a powerful message for people. We spoke about the myth around mental illness. So what do you think about the myth around treatment modalities and medications and in mental health?
No, it's a very good question. And we were talking about it that day, you see?
Yes, correct.
See, so some conditions like depression, there's plenty of evidence that exercise helps. So you don't need necessarily, everyone with depression doesn't necessarily need antidepressants. So antidepressants are medication to treat depression. Then, just what we call informal counseling, you see. So for many years ago, when I lost my mother, that was a very, very difficult time for me because she had cancer. I had seen her suffering, and then she had passed away. But, I was very grateful that in my own church, although they weren't trained counselors, my pastors, some of the elders, they were willing to talk to me about it, this informal counseling. And there is good evidence that informal counseling can help with depression, you see. And even if they have got clinical depression, for some people, what they need is talking therapy, to talk to a trained therapist. And there's plenty of evidence that a specific kind of talking therapy called CBT, cognitive behavior therapy, is very, very effective. You see, so medication is just the tip of the iceberg. Some people do need medication. Some people who just feel low a lot of the time. It's not that, we don't really call that depression. We call that dysthymia, a chronic low mood. They're not clinically depressed, but they are chronically low. Those people are helped by medication. And some people with, moderate or severe depression, they also need medication. And most of them are helped by medication. But I often find that people need a number of things. Okay, so they may need medication, they may need support to go out, because when somebody is so depressed, and they may not even want to wake up in the morning, let alone brush their teeth, leave the house, or eat. So they just need someone to support them in doing those things. Then talking therapy can help, etc. You see, but this is the important thing. If somebody is quite depressed, they may be too depressed to talk about it. They may be too depressed to get exercise, and they do need medication. Because at the end of the day, antidepressant is one pill that you swallow. It doesn't take much. And it does help many, many people feel better, to be in a position to do other things like exercise, pampering things, things to pamper yourself, talking therapy, etc., to engage in things a little more. So they need that to push them up so they can engage in other therapies. And if you need antidepressants, don't feel ashamed about it. It is just like any other health problem. Some people have asthma, they have to be on medication. Some have diabetes, they have to be on medication. Some get depression and they need to be on that medication. You don't need, with depression, we say you should just remain on it for about 6 to 9 months after your symptoms disappear. So you don't have to take it all your life. But you do need to be on it for a while, so at least 6 to 9 months after the symptoms disappear.
Thank you so much, Kalpana. Listening to you, the next question I wanted to ask as a follow-on question is, sometimes people get depressed or any other diagnosis in mental illness. As you mentioned, people go on medication, they become better, after 6 months to 9 months, as you said, they come off the medication. Sometimes people need medication for whatever reason. It might be life experiences or something happened, and they have to go back on those medications. There are many times I have witnessed patients themselves or the family around them tell them it's better not to keep taking these medications all the time, fearing they will be labeled with that mental illness forever. So what is your take on it?
I think this is a very, very good point you're making. And labeling is what we're calling, is a part of stigma, isn't it?
Yes.
For one thing, I think any health problem is your own private problem. You are not obliged to tell anybody about it. You don't have to say, hey, by the way, I've got asthma, hypertension, diabetes, and depression. You don't have to. It's your personal problem. Okay. If you are comfortable, and some people are comfortable talking about it, and I think especially people with mental health problems who talk about it openly in order to demystify it are very brave. And and I'm very grateful for them. But at the end of the day, it's your personal problem. Nobody needs to know that you were on so-and-so medication. Yeah. And you have to decide what is more important, your health or accepting that you may have an illness. See, and we talked about this too. Mental health problems can be just a response to a crisis, or it can be part of a longer chronic illness. I think a good example is asthma. You may never have suffered with asthma, and then you get a chest infection and you develop asthma, okay, and you have to take inhalers. It doesn't mean you're an asthmatic. It means in this episode of chest infection, you needed inhalers. You may never need it after that. And some people are like that when they experience a lot of life events, maybe a divorce, they've lost someone they were very close to, they've lost a job that they loved for so many years, they're facing a lot of financial problems, or sometimes they're facing all of them. We're only human, They may begin to feel depressed. It may just be that one episode, you see, and they get their treatment. And after that, they're able to get their life together. They have some talking therapy, they move on. They may never get another episode of depression. They may never need medication again. So for them, it was just an acute crisis. But other people suffer from what we call recurrent depressive illness. So it is a chronic illness, a bit like diabetes is, or actual asthma is. So they have to be on medication longer term, and still they may get some flare-ups, you see, because they are facing a life crisis during which they have to increase the dose of their medication. But normally we say that people for whom, let's say, depression is a chronic illness, apart from the medication, it's really important they have talking therapy, cognitive behavior therapy, because that will reduce the risk of them getting another relapse. But if they do, again, in most cases, it's something we can help them with. Get the help. It is a crisis. It will pass. Yeah. It's the same with asthma. Asthmatics do well. They get on with their life most of the time as if they have no asthma. But sometimes they have a crisis. They need to be extra medication, etc., to help them through that crisis.
Thank you, Kalpana. I thought it is very important for people to know this. People who are surrounding them, like families and friends, for them to know as well, so that they can support them in the right way and not give them misguided information for them. Another topic I really wanted to touch during the stigma is, sometimes people's perception of depression or any other mental illness is, it is for the weak. People who are strong don't get depressed. People who are strong won't get mental illness. Even for me personally, because I came from Sri Lanka, I had the war, I had the migration, I had the divorce, and you almost think you're invincible. And people around you always see you that you're very strong, you can throw anything at you and nothing will happen. What is your advice regarding this?
Yes, I'm really glad you said that, because not very long ago, I was watching a Netflix series on hospitals. And I remember in that series, somebody got depression. And it turned out the depression was because of a physical health problem, which can happen. You see, like as I said, your hormones, etc., can cause a mental health problem. And the doctor saying, oh, good, you don't really have depression. You're not really a weak-minded person. And I thought, this is terrible. This is supposed to be a modern series on hospitals. And they are basically lying to people. You see, as a depression is for the weak-minded. That is simply not the case. From my own experience, some of the strongest people I know suffer from depression, leaders, and the analogy I like to use is, see, if something falls on my leg, if it's a book, nothing's going to happen. Okay, because my legs are strong. But let's say bricks fall on it, or a car falls on something heavy, it's going to break. My body can only take so much. And my mind is very similar. Sometimes you're faced with tremendous adversities. And, I've known people where everything seems to come at once. They lose their mother, they lose their brother, they lose their job, their marriage breaks down. Everything happens at the same time. That is a lot of bricks falling on a human being. You see, it is only understandable that they become depressed. As I said, I know strong leaders who become depressed because they're so compassionate. They're so concerned about the people they're helping. I'm a Christian, for instance, and I have realized that a lot of pastors, they can become depressed because they're looking after so many people. And after a while, listening to so many people's problems, it really begins to pain them that so many people are suffering. And it is their compassion that makes them vulnerable. Far from being weak, they're actually strong and they are compassionate.
I'm so glad you mentioned that. Because I was about to ask you the same question, because I have even wrote an article about being a highly sensitive person and how to survive it and thrive on it. Because exactly like you said, when you are a highly sensitive person or empathetic person or compassionate person, however you term it, you look after others and you seem to put yourself at the end or bottom of the pile. And sometimes the weight becomes too much to bear. And what happens around you for even other people can affect you and cause these issues. I mean, I'm so glad you touched on that, because most of the people, at least I have known, they're pretty compassionate, like who have, struggled with these things. So would you like to elaborate on that, Kalpana, please?
Yes, sure. See, I'll give you an example of my own life as well, where a very close friend of mine very tragically lost a child who was very young. It wasn't my child, but this is one of my closest friends, almost like a sister to me. And I knew the child, you see. And I didn't get depressed, but it did affect me because I couldn't bear to see my friend suffering or this very sad loss of a life, you see. And I didn't get clinically depressed, but these things affect you, isn't it? You're really human. Had I got clinically depressed, yes, I would have sought help. I would have got counseling. I would have gone and seen my GP, maybe gone on some antidepressants for a while. But you can see that, as you said, somebody who is very sensitive to someone else's suffering, and the reality is we live in a world with so much suffering, and some people are very caring. You have in Afghanistan, you have children who are not who are suffering starvation practically, or all the problems that are happening. There are people who care so deeply that they cannot detach themselves from it. So it may not be the bricks falling on them personally, but just knowing that other people are suffering can impact them, And I find depression itself is, yes, it is a health problem, but I often think that it is also an existential problem. It makes people wonder, what is life about? Why am I here? Why is there suffering in this world? And these are good questions. These are philosophical questions. They're theological questions. And your psychiatrist doesn't necessarily have the answers for that, all of that. They cannot be your pastor, your philosopher, your imam. They can't do that. But what they can do is, if it has reached the point where you are unable to function, you're unable, if you've got children, to get up and take them to school, unable to go to work, etc., they can offer you talking therapy. And if you're so unwell that you cannot even engage in that, they can offer you medication, which will help you get up, look after yourself, resolve these problems, go and talk to someone. Maybe you need to speak, if you have questions about life, talk to someone, if you're a religious person, in a religious circle, to answer these questions. So depression is especially an interesting one, because I always think it is more than a health problem. It is an existential problem, because the questions people ask me when they are depressed, I think these are really good questions. They ask, why am I alive? What is what is life all about? Why is there so much suffering in the world? And they're good questions. And they're questions that every human being, personally, I think should come to grips with at some point. Yeah.
Thank you so much, Kalpana. And I could see tears in your eyes as you spoke about your close friend's son. And it shows how compassionate you are. And thank you so much for being ready to be vulnerable, because I think that is, how you can teach other people. Often I say it's okay not to be okay. I mean, you can't always be okay. And that is a burden we carry, because we want to be perfect and we want to be okay all the time. And it doesn't have to be the case. So thank you so much for demonstrating that so beautifully.
Thank you.
The other myth we have is, or might be some misunderstanding, Usually, there's a multidisciplinary approach in managing mental illness. There are many different healthcare professionals involved. Some people often get confused, and people ask me as well, between these different professionals who are involved in their care, particularly between psychiatrists and psychologists for sure. Would you be able to enlighten our audience? What are the different professions who are involved in this care, and what's the difference?
Okay, yes, I'll try and answer that question. So basically, psychiatrists are medical doctors. They're doctors just like your GP is, or if you see a surgeon, they're medical doctors. So they have a medical degree, and their approach to a mental health problem is very much like a medical model, you see. Psychologists have a degree in psychology. And there are a number of different types of psychology, okay? So there are psychologists who are experts in managing mental health, clinical psychologists, whereas others, that is not their area of expertise. Their expertise is educational psychology. So they can help a child who's struggling in school, for a variety of reasons. And there are other types of psychologists, forensic psychologists, who work in prisons, giving talking therapy to prisoners so that to reduce their risk of committing serious offenses. Okay. So that is a fundamental difference, that all psychiatrists are medical doctors. Although there is a lot of overlap, because there are psychiatrists who then train and get in psychological treatments and who offer that. And in the US, for instance, there are psychologists who work in mental health who are trained in prescribing medication, you see. So there is an area of overlap, but that is a fundamental difference. And what you need to know that when you see a psychiatrist is, it's like seeing your GP. It's very much the same thing, except the consultations may take longer, where you see a GP only for a few minutes, because psychiatrists can't take an X-ray of your brain. They can, but they won't know what mental health problem you have. They need to talk to you. So the consultations can take longer. So the first assessment, if it's a good assessment, will take at least an hour. And it's all talking. It's about trying to find out your whole story, not just what the problem is, because your whole story, the story of your life, where you grew up, what was your childhood like, all that can shed a light on what your current problem is. I sometimes, when I speak as a psychiatrist, when I'm assessing people ask, so why do you need to know about my school? Because I'm trying to get to know you, and that is the only way for me as a psychiatrist, I can know, is something wrong now, or is this just you? Is that the way you are as a person, your personality, or are you suffering from an illness now? And also, if you are suffering from an illness, how did this come about? What were the factors, you see? Yeah.
I think it's almost like a puzzle, isn't it? When you're making any diagnosis, you need so many different pieces to it. Many people got to know me so much better, I think, after I had the mental health issue. And obviously, firstly, I started to speak out more openly. And I often say I got enlightened after being depressed, because you definitely see life and people around very differently than when you are caught up in this hamster wheel lifestyle. You keep doing one thing after the other and you don't pause to reflect. You're a very different person. Exactly like you said, I think it is about knowing the whole story. But to know the whole story, might be somebody else might do it, but then medication might be given by somebody else, and then the talking therapy might be given to somebody else. And also, I think it's important for people to understand each person has their role, and everything is important in the holistic approach, helping out that person. Would you agree, Kalpana?
I absolutely do. And much of the treatment of health problems in the NHS is multidisciplinary. Doctors don't work on their own. They work with nurses, they work with occupational therapists and pharmacists. And interestingly, even in physical health problems, increasingly psychologists are coming in, to help people stop smoking, help with obesity, things like that, which are physical health problems, or just to stay on their medication. They're getting talking therapy now. And certainly this is true in mental health, you see. I think one of the best things about working in mental health, for me as a psychiatrist in the UK, it is multidisciplinary. So you get to work with nurses, get to work with psychologists, occupational therapists, etc. So actually you get a very holistic picture of the patient from so many different disciplines. So we are trying to understand someone's inner world while standing outside, and having so many different people's perspective gives us a better picture. I will never know everything about a patient, but I need to know enough to treat them correctly, isn't it? And that is what a multidisciplinary approach helps, where it helps enormously. I think it's very helpful. I remember many years ago, seeing a young man, and I asked my secretary to prepare the report. And this was a young Afro-Caribbean man, and he had his trousers hanging loose and he had his underpants. And I remember writing it in my report. And my secretary, who is an Afro-Caribbean, said, doctor, there's nothing wrong with that. It's very usual now for young men to have their trousers hanging low. This is years ago when it was becoming a trend, you see, and I didn't know about this. So it's actually really helpful to know, oh, look, this is a trend. It is not that he's exposing himself. This is a very unfortunate trend, that they want to show their underwear.
It's knowing the cultural nuances as well, isn't it?
Yeah, and getting that, because even if you work in a team, you have very often a multidisciplinary team. So people are afraid, understandably, about racism and mental health. But something like 40%, that is 4 out of 10 doctors, are non-white in Britain. And I can tell you about my white colleagues, white psychiatrists, they are very, very, very sensitive, and they don't want to, they want to understand people. And you work in a team. So, sometimes you're working with as I said, an Afro-Caribbean patient, but you will have someone in your team who's Afro-Caribbean or African or English, white English. And that really helps, because it helps you understand people even culturally, as long as you're willing to listen to all this. And I am very interested in it, obviously, to know them from a cultural perspective.
Thank you so much, Kalpana. I think it was very insightful to know how these things help, and I'm sure my audience will benefit from it as well. So thank you so much for that. Going from there, at times we hear certain mental health issues bear more stigma than others. So, for example, I have known schizophrenia seems to be the scary word. Why is it, and are there treatment for it?
I mean, that is an excellent question, and I'm glad you came to it, isn't it? Because there is so many myths around schizophrenia, and even the media, even modern TV programs, constantly spreading misinformation about it. People say it is a split personality. It is not a split personality at all. Okay. Schizophrenia is a serious mental illness. It is serious because you need to be on medication, and you need to stay on that medication for as long as your psychiatrist tells you to. And you can discuss this with them. This is why it is serious. But the positive fact is 2 out of 3 people with schizophrenia can be helped. And that is a very good number. With schizophrenia, we call it the rule of thirds, where 1 in 3 people will have a schizophrenic episode, they'll need medication, and that will be it. They will never need it after that. 1 episode. Yeah. 2 in 3 will have a chronic illness, meaning they have to remain on medication long term, not just 6 to 9 months, like in depression, but longer than that. And even when they come off it they have to remain on it for around 2 years. When they come off it, they have to keep seeing their psychiatrist regularly to make sure they're not relapsing. So this is why we say it is a serious illness. It's not something where really the family should be telling them, don't take that medication, because you are playing with a serious illness. As I said, if your family member has diabetes, you wouldn't tell them to stop their medication, because this will have serious implications, especially with schizophrenia. Please, unless you are their psychiatrist, don't tell them to stop medication, because it can have serious implications for them. But positively, it is entirely possible for someone with schizophrenia, even the chronic version of it, as long as they, stay on their medication, stay off things like cannabis, which make it very bad, and they have a healthy way of managing stress, where they are working, but they don't allow themselves to get overstressed, and develop a sort of a support mechanism around them, to do really well on it. I have met people who had schizophrenia, stayed on their medication 20 years, never had to go to hospital for 20 years practically, and who were working, who were in a relationship, who were giving back to their community. So it is entirely possible if you don't go and interfere in their treatment. But the reality, especially with schizophrenia, is people hate the diagnosis, and I get that. It's a big diagnosis. Second is they have their family, someone or friends saying, oh, don't take those medications, they're bad for you, or people encouraging them to have a bit of weed to chill out, when actually, especially weed can make the paranoia worse. It can lead to a relapse, so you feel as a mental health professional that you are fighting an uphill battle. On the one hand, you have treatments at work that will help the vast majority of people. And on the other hand, you have their family, their friends, community, society, pulling them in the opposite direction, telling them, stop your medication. Not realizing if you tell them to stop their medication and they have a relapse, you see, unlike depression, where people have a sense that they are getting low, or with mania, where they have a sense they're getting high, with schizophrenia, they begin to lose touch with reality. They don't realize they're becoming unwell, and they can begin to pose a risk to themselves or someone else. And they wind up they may need to get sectioned, which is why it's a serious illness. And you really shouldn't interfere with their medication unless you are their psychiatrist. And if you disagree with the psychiatrist, this is what I'm saying, trying to get across, you can get a second opinion. On the NHS, a second opinion is free, okay? If you think that maybe they should be better with other medication, or you think they should try therapy, talk to the health professional. And if you're not getting through this psychiatrist, get a second opinion. But please don't act as if you are their psychiatrist and tell them to stop medication, because it is a serious illness. Yeah.
And it has serious implications, as you rightly mentioned. Bipolar is, on the other hand, it's a totally different. Vincent van Gogh, because perhaps like people like Vincent van Gogh and Edvard Munch, who are really well-known artists. Do you think the stigma with bipolar is slightly different, Kalpana?
I think, unfortunately, there's a stigma with all mental health problems, Some of them are more acceptable, I think, like trauma, PTSD, post-traumatic stress disorder, with depression, okay? Because depression and anxiety is so common. Something like, 40% or 4 out of 10 people who see their GP see them for depression or anxiety, just so common, the stigma is less. Everybody knows somebody with depression or anxiety, or they may have someone in their family or have it themselves. Schizophrenia is a much rarer condition. And unfortunately, there is a lot more myths around it. And there are very few, if any, media representations which are accurate. And that's unhelpful. With depression, you have positive, better representations. You also do, interestingly, recently with mania. I can't remember which one it is, but there was, it's Homeland, I think, Homeland. Do you remember the Netflix series?
Yes,
Is it Netflix? Yeah. And the main character, Carrie, has a bipolar illness. And the representations were fairly good, And I thought it was fairly accurate in that when Carrie takes her medication, her mood is stable. But she likes to feel a bit high as well, and this is very realistic. This is what I find with people with bipolar. They like to feel high. And usually as a psychiatrist, it is about getting their medication to a dose where they are happy because they want to feel a bit high, and at the same time, they're functioning normally.
As we call the happy medium, isn't it?
Happy medium. Perfect. Yes.
Thank you so much, Kalpana. I think we have touched upon so many different things. And postpartum depression, like you mentioned, is coming to light very recently, particularly in South Asian communities. It was not a norm, it was not accepted. But fortunately, I think the awareness is more right now. Same with menopause. I think you did touch upon hormonal imbalances when people go through menopause, how different people feel. I'm glad that these things are more widely talked about these days. The one important question I want to ask is, we are hearing about mental illness and at times with devastating effects in teenagers and young adults more and more. As an expert, what is your opinion on this? And even like taking, I'm sure you will touch upon taking weed and cannabis and that's its implications. And because, we all have been on in college days and everybody wants to take a bit of risk and peer pressure is on. So what's your take on it?
Yes, I think I thank you for asking. It's a very good question. There has been a rise of mental health problems among the young people. It is not entirely clear why that is, okay? But we have some possible explanations, okay? And certainly cannabis, weed is a very big thing, I think cannabis is like Russian roulette, that game where somebody takes, it's not really a good game. It also with a gun, isn't it? Where they load a gun with just one bullet, and they take it to their head and they shoot themselves, and usually blanks, but they're taking a risk.
I'm not sure whether you are aware, Kalpana. There was a couple who are YouTubers did this on screen and someone really got hurt.
Gosh, yeah. So you see, it is a game. It is a game of luck, but which can have potentially devastating consequences. And cannabis is just like that, you see. There are certainly people who think they take it, they feel calmer, but there are certainly people who, after they smoke it once, will develop a psychotic experience, and may need to be sectioned. And it might be the start of a serious illness like mania or schizophrenia, which is why it is a very big risk that you're taking. I've got children and I tell them, I hope you never try it because it will be undertaking a very dangerous experiment with your mind. So I think cannabis plays a very big role, and I cannot stress enough why people should not just go ahead and try it, because you may wind up sectioned in a hospital. And I'm not just joking. I have literally seen university students who are doing so well in their life. They go to a party and they take it. And then there I am as a psychiatrist, finding them in some field, sectioning them, and that is the start of a schizophrenic illness. It's a very dangerous experiment you're playing. Your friends may say, oh, I've tried it. Most people are fine, all that. But, I don't try everything just because somebody is trying it. So be your own person, be a strong person, be that person who doesn't want to try something that will potentially have devastating consequences on their life. The other thing is social media. So young people's way of socializing is on social media virtually. And it does have a lot of advantages. There's a lot, you can get good information on mental health problems, etc., on social media, but it also means that they are avoiding face-to-face contact. And a lack of socializing can make you vulnerable for mental health problems. Actual socializing, face-to-face, and getting to know. And one of the previous presidents of the Royal College of Psychiatrists, he said this really good thing. He said that when a young person is depressed, maybe what they need is not antidepressants, but to join a choir. What they need is a social setting. They need to get out there. Maybe they like cooking. Go join a cooking group, or maybe, whatever it is, they need to develop a hobby. Maybe they love reading. Join a reading group. You need to go out there and get people, and if you are religious, you certainly have that, isn't it? For instance, Sikhs are very social. They have gurudwaras, you see, or Christians have their house groups, where they meet in small groups. These are actually healthy for your mind because you are socializing. You're getting to know people. You're making face-to-face contact. You're enjoying their company, you see. So I think with young people, what they need is they need to take exercise, because good exercise is good for your mind. They need to eat a healthy diet, because a healthy diet is good for the mind. They need to socialize, and they need to avoid things which are just very dangerous for their mind, like cannabis. And even cigarette smoking can increase anxiety. People think that when they smoke, their anxiety is being relieved. Actually, it's the other way around. There's evidence that nicotine increases anxiety. So they should avoid harmful habits. Yeah. And even spending a lot of time playing PlayStation games, because now gaming, there's gaming addictions, and they're offering treatments for it. Because if you like gaming, that's fine, but try and set limits on it. I'll play for, only on weekends, or I'll play for 1 hour and that's it. I'll call time out.
Thank you so much, Kalpana. I think even we adults are sometimes glued to phones and digital media and social media. So it's a very powerful message, very important message, very beautifully, impactfully put across. Thank you so much for that. As you are a forensic psychiatrist, I cannot help but ask, how is it different working with prisoners?
Yes. So I am a forensic psychiatrist, as you said, and I work in a prison. So I love it. I love working in a prison. And what I can say is prisoners are like anybody else. They're human beings. The difference is they're usually very, very poor. I remember one social worker saying this, and it was very poignant for me, because she said, they're all so poor. They're dirt poor. And this is one of the saddest things for me, working in prisons with serious, both with petty criminals who just commit thefts and robberies and burglaries, and also with serious criminals, is that the vast majority of them are not just poor, they're dirt poor. I was working in a young offender prison many years ago, and for Christmas, the occupational therapy department, they had a Christmas tree. And I think they got these young people small £1 presents from a pound store. And these were 15-year-olds, because that's when they can start going to prison from. And for some of them, they said, this is our first Christmas tree. They never had a Christmas tree before that. They'd never been given a Christmas present before that. And you have to remember, they're not just poor, they're really, really poor. And the sad tragedy of life is that we seem to be packing our prisons with the poor, and we should be doing more to help children when they're young, so that they know they're loved, they know that they're not stupid, but they are clever, and trying to take them away from a lifestyle of crime, because they're growing up not knowing that they're loved, maybe because their parents are drug addicts, not having enough to eat because their parents can't look after them, either because they have their own addictions. And they are told in school that they're not very bright. They're not, their talents are not being realized. And as a consequence, the only life they know is a life of crime. And then you find out when you work with them in prisons that actually they're very talented. Some of them are musicians, some of them are poets, some of them are artists. Maybe they were not good at mainstream English and math, but they have got incredible talents, and some of them just have a desire to help people. And very unfortunate, because they've got into a life of crime, a pattern, an addiction in itself. They just don't know how to channel all the good things they want to do. So when you ask what are prisoners like, I think it's like they're like any other human beings. If anything, they've come from very deprived backgrounds. Yeah.
Thank you, Kalpana. I think there was an interview with Oprah more than a decade ago, what I watched. And I think that really opened my eyes. And that's what got me into looking into these things a bit more. I think somebody wrote a book, and there are many projects by how being compassionate, understanding, and showing empathy, you can change this culture of, from marginalizing these criminals to into being, reforming them. In fact, it's so important, because we are all, as human beings, we are gifted with this judgmental behavior. We are quick to judge without knowing the whole soul story, exactly in your words, like you said. And I think we should perhaps think twice before doing it next time around. So thank you so much for saying that. We have come to almost at the end. I didn't even see the time passing. You kept me engaged really well. Thank you. What are the 5 takeaways for the audience? What they must take home from today, and how can they help? Obviously, people who are here, they're part of family, part of communities. There are a lot of medical professionals sitting around here. What do you want them to take home today?
Okay, I think that's a really good question. And what I'd like people to know is physical health problems and mental health problems are very much the same. They just affect different parts of the body. Okay, so just as you can do things to improve your physical health, like exercise, eating a healthy diet, there are things you can do to improve your mental health. Okay, and so some of my takeaway points are, first of all, create a time for rest. Okay, whether every day you need to create a time for rest. That should be, you should be intentional about it. And every week, try and take at least one day off. And when you're working, try and take time off for regular breaks, holidays, even if you don't go anywhere, just to take a break from work. So the first thing is, be intentional in getting a rest. And when I say, because the way people think, they feel they have to keep on working, or they're not producing enough. And that is actually like running your car endlessly. It's going to break down, and it's running your mind or your emotions endlessly, So take a break. That's the first one. Second is develop a hobby. Whether it is just, if you like nature, nature is, I think, is God's own therapy. That's the way I look at it. Just a walk by the beach, the sound of the waves, or a walk in a forest, looking at the greenery, the sound of the birds, and enjoy it. It is art therapy, music therapy. It is all kinds of therapy all at once. So develop a healthy hobby, especially one that has to do with nature. Yeah. Or also, if you don't, because you find England cold, develop a healthy hobby like reading books, or go to art museums or enjoy art. Yeah. So develop a hobby. The third thing is take holidays from screen time. Okay, at least what you can do, because today somebody was saying something like 50% of people feel anxious if they're away from their phone. 50%. I don't know if this is true, but somebody was saying this. I didn't check it, but that's very interesting. Take time to turn off your phone every day. For me, it's in the evenings. At the end of the day, I'll keep my phone away. Take time to switch off your phone. And even when you go on holiday, be intentional, put an automatic reply on your email, leave an answer phone message saying, hey, I'm away, I'm not available. Make arrangements for someone else, if you are a doctor or something, to cover you, and turn your phone off. Turn off screen time. If you want to read a book, buy a paperback. Don't go on your phone, because that means you will be bombarded with notifications and you won't be working. Or you might be by a beach in the Caribbean if you're very lucky, but you will still be answering emails, work emails. So turn off your phone. And the other two are, then the next is avoid unhealthy habits for your mind, such as alcohol. If you know yourself, if you're the sort of person who cannot do things in halves, you have to do things in excess. See, I don't drink, and it's not because I think drinking is sinful or anything, because I know me. I don't do things in halves, and there's a very big risk I'll do too much. So I just don't go there. Don't try cannabis, okay? Because it's Russian roulette. And the last point is, if you or a loved one if you think they have mental health problems, seek help. In the first instance, if it doesn't seem very serious or urgent, you can call it a helpline like Samaritans, which is free. But otherwise, you can call NHS 111. But if you think it is more serious, get an appointment with your GP. Get help, get it early. And if you can ask questions, if you can ask, is there a talking therapy? Are there other medications? What are the side effects? People will be willing to help. Okay, so those are my 5 takeaway points. The first 3 are do positive things to help your mental health. Take a rest. Take a break from screen time, develop a hobby. And the other 2 are fourth is avoid things that can be potentially harmful to your mind, like cannabis. And finally, if you need help, get it. If you don't mind, I'm going to add one more point. You asked for
Oh,
five,
of course,
I'm going to add a
of
sixth.
course, feel free. The more, the better.
Develop a social circle. Some people are lucky to have very good, extended families. Don't let your social circle be one good friend or one spouse, because the reality is, if anything happens to them, that will be the end of your social circle. Develop a circle. Some people have lovely extended families. It's like aunties, cousins, all of them, and they've developed good communication skills and they're free. But you can develop a group of friends like that, or it can be within a religious setting. You have a church group, or you have, friends you made in the temple. Develop a social circle of people who over time, don't tell them everything about you immediately, whom you find out over time you can trust. Because that's really, really important for your mental health. We were created to be social beings.
Thank you so much, Kalpana. I think the last point I resonated so well, because I think the last time we had a celebration, I did say friends like family. That's what I have been blessed with. So it is not that I'm not close to my family. It's not many people are blessed with friends like family. So thank you so much for that. And the other thing I have to reiterate is, yes, we never forget to recharge our phones and laptops, but somehow we never take the time to recharge ourselves. And you reiterated on it. So thank you so much for that as well. I, for one, have gained so much insight into the mental illness and how it is seen, how it is treated, and what we shouldn't do, and how everyone can help demystify this issue. So thank you so much, Kalpana. It's been really, really useful. I learned a lot for sure, and I'm sure my audience learned a lot as well. So for people who are on Zoom, please hold on. You will be given a chance to ask the question directly from the speaker. Following tradition, I'm going to announce the next episode, which is Building Relationships, in honor of Valentine's Day on the 14th of February. Ours will be on the 13th. So episode 77, it will be Professor Dr. Simi Kacharya from India, and she will be talking about building relationships. She's a speaker, senior mentor, teacher, neurogenetic expert, behavioral scientist with over 30 years of global experience and an Ivy education. I'm really looking forward to listening to that. Now, over to Dr. Kanta Niranjan to give the vote of thanks.
Hi, Dr. Kalpana. On behalf of Meet Menaca, I have the great privilege to give a vote of thanks. What an excellent talk. You started very lightly talking about things, how we have to differentiate, or we should not differentiate physical and mental health. Since I'm a physician, I know a lot of mental health problems arise from physical health as well. Very lightly you started talking, and then you shared your experience. And it's very touching to hear your experience working with prisoners. One thing in my life I find very difficult to work with younger people. I have been always, because of the emotional things are very high, even for our own self, seeing the suffering of younger people. And you have a very challenging job. I can see that. And how passionate you are doing, and the way you speak and talk is really touched all of us here, I'm sure. Very, very much touching. Your talk really touched us. All of us feel high, low, crazy, and sometimes we don't know when to ask for an expert advice or for seek help. That can happen to anyone. There shouldn't be any stigma at all. The late wartime Prime Minister Winston Churchill is well known to suffer from depression time to time, such a higher intelligent man. So there is no stigma at all in saying that. We all should accept that, because all of us go through that in life. And today your talk gave us some valuable, very good points to every one of us, to not only for care for others, and also to making sure to inform others to take their medications. And one last thing which I liked in you, and I always believe in that, taking personal care for our health, very important, and also socializing with like-minded people, That is very, very important. We should have different groups, meet with, take time off from the work or stress. And that is, personally, I feel that that is one of the most important aspects. So we should offer to people who are lonely and try to bring people together. Menaca is already doing that job, bringing many people together in the platform. Kalpana, you have been a great inspirational speaker. I'm very proud that you came to this forum today to talk about. Really, our admiration to you. Well done. Congratulations for a lovely talk today. Thank you very much.
Thank you so much. Thank you so much, Kalpana. As Kanta said, it has been a really powerful session. For people who are on Facebook, it is that time of the day to say goodbye. Next time, we will meet with our episode 77, Building Relationships, with Professor Dr. Simi Kataria. Until then, stay safe, be healthy, and keep smiling.